You can go live now.
Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patient to access the right treatment on right time. It is my immense pleasure to introduce Dr. Krishnamani, a pioneer medical professional specialized in medical oncology and who has more than 10 plus years of experience. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. As you all know, November is the month dedicated to raise awareness about lung cancer, which is very common in India. And also, sadly, to address it is increasing, the cases are increasing day by day. So, today we have Dr. Krishnamani who will guide us in this journey of knowing about lung cancer. So, without any further ado, let's welcome Dr. Krishnamani to this live session on Cancer Reach. Good afternoon, Doctor.
Good afternoon. Hello and welcome to Cancer Reach. As you all know, it's an initiative to spread awareness on cancer and address basic questions for patients, attenders, lay public, etc. As you already said, this is the Lung Cancer Awareness Month in November, and lung cancer being so common, let's discuss about this common cancer today and learn a little bit.
Thank you, doctor. So, doctor, just to start with, can you just highlight like how common is lung cancer?
See, if you look at the top 5 cancers in our country, lung cancer comes there. Okay. So we talk about lung cancer, we talk about breast, head and neck cancer. So cervical cancer. So this is up there with the top cancers in the form of incidence. Incidence means in the number of new cases we see, and also prevalence. And prevalence means the number of cases which are seen in the population. So lung cancer is an extremely common, especially more common in men. But obviously the numbers are rising in women. Reasons being most cases, obviously, because the women, most women are non-smokers, and we also see lung cancer in non-smokers, and maybe also due to a rising incidence of smoking in women. That could be especially in the urban areas. But that said, it's a common cancer, one of the most common cancers in men, and also with a rising incidence in women, commonly seen in smokers. But today you almost have, if you see 10 advanced lung cancer patients, maybe 4 or 5 out of 10 are seen in non-smokers, men or women.
Okay. So, doctor, this can be because of passive smoking kind of a thing, or
So what we should understand is the single commonest factor is smoking.
yes.
But the demographic has changed. That is, 20 years back, if you had 8 out of 10 people due to smoking, now you have 5 out of 10 non-smokers also. So that
Oh,
so smoking has to be reduced. There is no two things about it. But even non-smokers get. Commonly, as you said, one due to passive smoking or second-hand smoke. Somebody smokes in the family and you're exposed to that smoke. Or some occupational exposure, like people who work in asbestos factories, people who work in coal
oh,
factories.
yes,
It's
yes. Okay.
called, you get a disease called coal workers pneumoconiosis, and then develops into lung cancer because of inhalation of the fine dust,
Mm.
silica, radon gas. So this is all occupational. The asbestos dust is very fine. So chronic exposure daily at the workplace, unknowingly they inhale, it goes into the lungs, it causes irritation in the lungs, and then becomes cancer many years later. So smoking, passive smoking, occupational exposure like asbestos, coal, worker pneumoconiosis, etc. And many of the times we don't know, we attribute it to air pollution, the bad air we breathe, especially see, the air pollution is responsible significantly for diseases like chronic obstructive pulmonary disease. We call it COPD, where patients come with breathlessness with repeated attacks. And it is also a causative factor for lung cancer, especially air pollution.
Especially, doctor, in cities, I guess during the office timing, highest traffic, can that also be the reason for?
Traffic, industrial pollution, the quality of the air, which we all talk about so much, especially during winter months where there is a lot of smog. The air doesn't get out of the
Yes.
immediate atmosphere we are in. So all these are issues.
So, doctor, is there any way we can prevent it, or at least we can try to prevent it?
So see, first of all, stop smoking. Number one,
Yes.
there's no two things about it. You quit smoking, your risk of lung cancer comes down dramatically. In fact, a person who has smoked extensively, if he
Hmm.
stops smoking for 15 years,
Hmm.
his risk is like a normal person who never smoked.
Oh, okay.
So that's the advantage of stopping smoking, number one. Number two, see, traditionally, if you see, and especially in India, there were a lot of women who, our households used to have a different method of cooking, where we used to use that small pipe and blow into the coal. So
Yes,
there
yes,
also
yes.
we have seen those women of those ages who have practiced this type of cooking for 30, 40 years. They used to blow the pipe and then heat up the coal, being
Yes,
exposed to that coal dust, and they have had lung cancer. We've seen few patients. No, no, those things have changed. You have gas supply or you have
yes,
piped gas
yes.
supply. So you're not, our men and women are during cooking are not exposed. Third,
Yes.
use personal protective equipment, which is mandatory now in most places of work to prevent occupational exposure.
Okay.
Air pollution, obviously, it's a governmental decision, and people should take. They are taking some action on it. So, bottom line, stop smoking, and I think avoid pollution or try to use masks when you go out. Avoid any potential allergens. Cover your face and nose when you go on a dusty environment, not only for lung cancer but for respiratory diseases.
Okay. In fact, doctor, if I'm not wrong, if smoking is quit, almost 50% of the lung cancer is taken care.
Not only lung, we have thousand times we have emphasized from the lip down into the gut. Smoking is responsible for diseases like leukemia, for bladder cancer, for prostate cancer, for gastric cancer, for pancreatic cancer, for lung cancer, for head and neck cancer. So you name it, it is associated to smoking.
Oh my
So
God.
stop smoking. You can probably stop 16 varieties of cancer.
Sir, then I will rectify my sentence. 50% of not lung cancer, other cancers are also taken care if we quit.
Definitely, definitely.
So, doctor, like in this journey, how can we diagnose lung cancer? Or like what are the types of lung cancer?
So commonly see patients, what should they be aware of? If you have chronic cough for 1, 2 months, which is not going away.
Yes.
If you had a pneumonia, they have treated you. The doctor sees you again and he says the patch in the lung is not getting better. It is still like the same. So
Hmm.
a non-resolving pneumonia, we say. Pneumonia, which is not resolving, means not getting better. You have cough and bloody sputum.
Okay.
You have severe chest pain and you are detected to have a mass in the lung. You are having
Okay.
breathing difficulty. So breathing difficulty, chronic cough, chest pain, cough with bleeding, blood in the sputum. These are all again, see, chest pain can be due to gastritis also, can
Yes.
be due to trauma. Breathing difficulty can be due to heart problem also, or even asthma. So these are not specific for lung cancer, but if they are there, they are for a longer duration, seek attention. If the disease spreads to the brain, you can probably have fits, seizures, weakness in one side of the body. You can have severe headache, double vision. So then suspect that it has gone to the brain. If it has gone to the liver, you may have pain in the tummy on the right side. If it has gone to the backbone, you may have severe back pain.
Okay.
So these are the symptoms you should see. So if you have any of these are abnormal symptoms, you're losing a lot of weight, appetite
Hmm.
has come down, any of these abnormal symptoms, watch out, go and seek attention. What will be done first? When somebody comes like this, they're probably going to do an X-ray first. They'll
Hmm.
probably find a mass in the lung or a rounded, we call it opacity, or a simple
Okay.
a tumor or a mass or a lump, whatever. Then you'll be asked additional tests like CT scan or PET CT scan to give more clarity, number one. Also to see where all it has spread. Again, a scan is never foolproof of a diagnosis. It only says there is something here, the size of this is this much, and it has spread to these areas. It will never say this is cancer. So then what do you do to diagnose? You need to biopsy. So as we always say, we will do a needle test to diagnose the tumor. You will do scans to stage the disease, which stage it is. If it has spread to the brain, if there is water around the lung called pleural effusion, if it has gone to the liver, bone, it is stage 4.
Okay.
If it has gone to nearby lymph nodes, it is generally stage 3. If it is only in the lung, it is stage 1 or stage 2. So only in the lung, stage 1 or stage 2, gone to the lymph nodes, stage 3, gone to all parts of the body, stage 4. So I
Hmm.
will do tests to establish diagnosis in the form of biopsy. I will do tests to stage my disease in the form of CT or PET CT. I
Okay.
will do routine blood tests to check the fitness of the patient called CBC, RFT, LFT, complete blood renal function and liver function.
Okay.
This is the way you diagnose.
Hmm.
Now, on the tumor, you do some special tests, two tests
Okay.
basically. One is called immunohistochemistry. It is
Okay.
done on the biopsy tumor, it is done in the lab. That will
Okay.
tell you what type of lung cancer it is. Squamous lung cancer, adeno, there are types, small cell, squamous, adeno, large cell. That much it will tell you. To go more deeper,
Hmm.
you will do after this something called molecular test, which are
Okay.
more positive in non-smokers. And if they are positive, you can give them tablets instead of chemotherapy or immunotherapy instead of chemotherapy. So the patient comes with these symptoms of chest pain, breathing difficulty, uh, blood in the sputum, or due to spread to other organs, or weight loss, loss of appetite. You
Hmm.
suspect lung cancer. Initially, you will do probably an X-ray. If you see a mass, you will do a CT or a PET. That will tell you the stage also. Then you will biopsy that from the
Okay.
easiest area. Suppose it has spread to the lymph node here, you will biopsy from here, supraclavicular lymph node.
Okay.
Then you will do IHC on that, say what type it is, small, adeno, large, squamous. And finally, you will do molecular tests to see in advanced cancer if this patient can qualify without chemotherapy. And the molecular test should be done in everybody, but they are more common in non-smokers. In smokers, if you send molecular also, you can tell your patient, most likely they will be negative. You may need chemo. But in non-smokers, you can say most likely they will be positive. We can avoid chemo and we can put you on tablets for that specific mutation. For EGFR, there is one tablet. For ALK, there is a tablet. For ROS, there is a tablet. Or you can say, we'll do something called PDL1 on the tumor. If it is positive, we'll put you on immunotherapy.
So in short, doctor, even the treatment versus if we say the non-smoker treatment can be easier than compared to a smoke.
Non-smokers, advanced cancer, we are talking,
Hmm.
easier. We call
Okay.
these mutations a driver mutation. So
Okay.
non-smokers do driver mutation analysis. If they are positive, no need of chemotherapy. Put the targetable tablet for that. It targets the mutation, gives better results than chemo, longer survival, excellent quality of life, and they take tablets sitting at home.
Wow. Oh, the technology has made I mean, say,
So
comfortable for a
science, due
patient.
to the science, you have identified a mutation and then you have created a drug to target the mutation. And if that drug fails, now there are second generation, third generation, fourth generation drugs also, which are better than the first generation. So it is like your iPhone 14, 15, 16, better versions.
Better version. Good. That's so, doctor. When you are telling something about molecular testing, what will be the role of a molecular markers, doctor? Can you just brief on little
That is
bit?
what we discuss now. Molecular markers in advanced lung cancer patients. Also
Okay.
in early lung cancer, we do nowadays after surgery. So
Okay.
for the benefit of most patients, let us keep it simple. If you have advanced lung cancer, send your tumor for molecular markers. Again, as we discussed, if you are a non-smoker, high chance of coming positive. And if you
Yes.
are positive, you will be given specific drug for that. For EGFR, we give you osimertinib or erlotinib. For ALK, we give you alectinib. For ROS, we give you crizotinib. So these drugs are not chemo, they are tablets. They work better than chemo. Chemo causes all side effects due to effect on all cells in the body. This affects only the cancer cells. So the side effects are much, 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 much lesser than chemotherapy.
Oh, wow.
And excellent quality of life. Cost also is less. Is apart from certain medicines like alectinib or the osimertinib. For example, erlotinib is as cheap as 2,000 rupees a month. Geftinib is as cheap as 2,000 rupees a month. But I know osimertinib and alectinib is still extremely expensive. Things will probably change.
Yes, touch wood. Nowadays, many of the medicines with the government initiation, the prices are coming down.
Correct. True.
So this will also be in future, it will be more affordable for the patient. So, doctor, when you are talking about the treatment journey kind of a thing, can you brief on treating early lung cancer just to enlighten our
So
audience?
understand that most cancer patients end up in stage 3 or stage 4 lung cancer.
Are you okay?
For some reason now, suppose I go tomorrow, get a master health checkup done, or I'm coughing for something and I go a scan and they pick up a small lesion, I'm lucky to pick up that lesion. So as I
Okay.
told you, the tumor is small, confined to the lung, it is stage 1 or stage 2.
Yes.
Early lung cancer, always try to operate if you are fit. Imagine I'm
Okay.
90-year-old, you say I have early lung cancer, you have to operate and remove my lung. I will not tolerate anesthesia. So the point is whether I'm fit and whether it is operable. You should be both. You should remove the tumor also. It should be small enough, early stage, and the patient should be fit to tolerate the lung surgery.
Okay.
That is one. Nowadays, in certain early lung cancer, like stage 2, we give immunochemotherapy before and then take up for surgery.
Okay.
So remember one thing, early stage lung cancer is rare. Early stage, you should try for cure,
Hmm.
generally surgery, if the patient is fit, followed by chemotherapy, stage 2 and beyond.
Hmm.
In stage 2, sometimes you can do the reverse, give chemoimmunotherapy first and then do surgery.
No surgery. Okay.
Stage 3 means it has spread to the mediastinal lymph nodes, this lymph nodes between the
Okay.
two lungs. So
Hmm.
that time, usually you give radiation for 6 weeks with chemotherapy
Okay.
every week for
Hmm.
6 weeks, followed by immunotherapy for 1 year.
Okay.
That's all. No surgery there. Stage 4 means it has spread to other areas. There, as I told you, do molecular markers. If you are molecular positive, give those medicines. If you are PDL1 positive, add immunotherapy. If you are all negative, give chemotherapy.
Oh.
Okay? All these medicines are given, and every 6 months you will scan the patient in stage 4. If the
Hmm.
scan is good, patient is good, tolerating the medicines, continue the medicines. The day the scan shows progression or disease increases, that day you will stop the medicine and you will change the medicine.
Okay.
So stage 1 is surgery followed by
Hmm.
chemo. So surgery. Stage 2 is again surgery followed by chemo or chemo immuno followed by surgery. Stage 3 is chemo plus radiation, no surgery. Stage
Hmm.
4, no surgery, no radiation, either
Yes.
chemo, either immuno or tablets.
Tablets. Okay. So, as you doctor said, early detection will be very luckily the patient can come to know. But maximum of the lung cancer are detected in which stage? Third
Third and
stage,
fourth, 80
third and
to
fourth.
85%.
So, doctor, they will be coming under treating in advanced cancer, if I'm not wrong.
Correct.
Oh.
True.
Oh. So, doctor, even detecting a lung cancer is a very luck and a tricky kind of a thing.
Correct. So to detect lung cancer early, especially in heavy smokers,
Uh-huh.
every year annual CT scan is suggested. If you are a
Okay.
current smoker or a heavy smoker, they say do a CT scan every year
Hmm.
because you have high chance of lung cancer. We will do CT so that every year, if there is something, we'll pick up it at a very early stage.
Okay.
But the better thing is, okay, do CT scans, ask them to quit smoking.
Instead of burning money on smoking as well as on scanning.
Correct. Correct.
So
Not
we
only
can,
for your health and all that.
yeah. So doctor, heavy smoking is like how many
Two
cigarettes
packs a
that,
day, 3 packs a day, that is 20 to 30 cigarettes a day.
my God, okay.
Anything beyond 10, 15 is heavy.
Okay. Even doctor, one, two in a day is also the patient can have a chance of getting.
Smoking is the worst thing. So sometimes people talk about smoking versus alcohol. Smoking is worse than alcohol. So just quit. Not that we are endorsing alcohol. So quit both. Don't have any vices, but smoking is really bad.
Okay. So, doctor, you were telling about the advanced technology of the treatment for the lung cancer, different kind of a treatment. Can you enlighten just a small doubt? Does everyone needs chemotherapy or no, not everyone?
We spoke about now. If you're
Yeah,
EGFR
stage one.
Alcross positive, advanced lung cancer, we are talking about. If you're driver mutation positive, no chemo. If you're high PDL1, get away with chemo, only immuno. Only if you're negative for all this, we give you chemo. Or
Chemotherapy.
in a disease called small cell lung cancer, we give you chemo, where we also
Okay.
add immunotherapy.
Okay. So even small cell cancer is also a type of a lung cancer.
Small cell is a very bad cancer, seen exclusively
Okay.
in smokers, extremely aggressive, has bad prognosis compared to this adeno and squamous, which is non-small cell, seen only in smokers generally. Survival is less than 1 year.
Okay.
Treatment for advanced stages chemo plus immunotherapy. So bad
My,
disease seen in smokers, poor prognosis, comes back early, chemo plus immunotherapy in advanced. In non-advanced cases or limited disease, we say treatment is chemo plus radiation.
oh my
But
God.
whatever it is, the prognosis is poor. It is unlike non-small cell, where if you are a non-smoker, if you are driver mutation
Mhm.
positive, you will live beyond 3, 5, 6 years also.
Wow. But oh, so doctor, you in this discussion you were talking something that the cancer in stage 4 can go to brain. So can you explain a little bit more on like what metastasis in lung cancer to brain?
You
Can you
see,
brief a little bit more on that?
this is called hematogenous spread. Hematogenous means via blood. From the
Okay.
lung, via blood, goes to brain, goes to spine, goes to liver, goes to opposite lung.
Okay.
When something goes to your brain, what can happen? You can develop terrible headache. You can have double vision. You can have severe neck pain. You can develop seizures. So an adult who is developing new onset seizures, he never had fits in the past. They
Hmm.
do the brain MR. They find a lesion in the brain or many lesions in the brain. Check the lung. If it is a woman, check the breast. You may have breast cancer which has gone to the brain. You may have lung cancer which has gone to the brain.
Okay.
They may develop paralysis of one side. They may develop facial deviation. The face may go to one side, the lips
Yes. Yeah.
basically. So you will do a CT scan or an MRI more importantly, and then treat the lesion. If it is a single lesion, sometimes you may opt for surgery.
Hmm.
There are many lesions, you will opt for radiation.
Okay.
Chemotherapies don't go into the brain, so they don't work. So
Yes.
you have
Big.
to do a local treatment, either surgery,
Hmm.
either radiation or SRS, we say, whole brain radiation or specific radiation. Now, this,
Okay.
whether surgery or radiation, depends on a lot of factors. How old the patient is, how fit the patient is, whether they can tolerate surgery, is you have one small lesion or multiple lesions, what is the status of the disease outside, is it under control, is it very bad? So based on all these factors, you are talking about the brain. But brain chemos don't enter. Brain, you have to do either surgery or radiation. And it
Oh
spreads via blood. And these are the symptoms. And you have to do an MRI.
my God. So doctor, the brain cancer or I is the right term. I don't know whether we
No, it
can call
is
it or
lunged with brain metastasis. It is not
brain
brain tumor.
metastasis.
It is lunged with brain metastasis.
So, doctor, the brain metastasis is very tricky and risky to treat for a patient also.
If you don't treat somebody with brain metastasis, survival is less than 3 months, maybe. Now,
Oh
the
my.
beauty is, please understand, in this driver mutation positive advanced lung cancer, if you develop brain mets,
Hmm.
sometimes you can avoid this radiation because these tablets go into the brain and work, unlike chemotherapy. So the
Oh,
advantage in EGFR or ALK positive patients is even if they develop brain metastasis, small brain metastasis we say, and they have no brain symptoms like headache, vomitings, and all that,
okay.
you can avoid radiation and you can tell them my tablets will work outside the brain also and inside the brain also. Will shrink
Wow.
your brain metastasis also. We can
Hmm.
avoid radiation for now.
Okay.
That is the beauty. The newer generation tablets,
Medicines.
the fourth generation or third generation, which is called osimertinib or alectinib.
Oh, okay, okay.
The older generation don't go into the brain. So their patients were receiving radiation. So now what's happening? You're giving one tablet, controlling disease everywhere in the body, including the brain,
Brain.
trying to avoid radiation also. But if you have large brain metastasis, patient is unconscious or very sick, then this tablet may not work so quickly. You may need radiation. But I'm talking about multiple small or single brain lesions, too small. Patient is having no symptoms in the brain. This is the best thing. You can avoid radiation, have a close watch. Patient develops symptoms, give radiation. No symptoms, don't worry. Within 3, 4 months, that will disappear. They're
Even
not
the
cured. They are
hmm,
not cured, but controlled.
even the quality of life of the
Correct.
patient will be yes. Yes. Advancement of the medicine is so helpful nowadays for a patient's doctor
This
then.
is one disease where there has been tremendous advancement.
Wow. But still quit smoking. Though the treatment advancements are available, doesn't mean that
Correct.
continue smoking and take treatment. Quit smoking. So, doctor, actually, the topic is so interesting, but we have come down to the end of this webinar. So, I I want to know more about the lung cancer, but we can have something continuous, or we have so many knowledgeable videos on lung cancer on Cancer Reach website
Already,
also.
yes, we have discussed about all that in our
Yes.
website.
Yes. So, Doctor, as we draw to the end of the webinar session, I want to extend a heartful thank you for Dr. Krishnamani. Doctor, would you like to give some closing comments on this, especially Lung Cancer Awareness Month?
Yeah. So lung cancer is common. Quit smoking. Even non-smokers get 40 to 50% times. Early lung cancers are rare, but if you get it, surgery is generally the main part of treatment if you are fit for lung cancer surgery. Advanced are most common. Check for mutation analysis like EGFR, ALK, etc. If you are driver mutation positive, go for tablets. You can avoid chemo. And the prognosis in driver mutation patients, even in stage 4, is excellent. Patients live beyond 3 or 5 years today. So don't think it is stage 4 lung cancer, driver mutation positive, he or she is going to die within 6 months. It's rare. With today's medications and today's research we have in cancer, many of these patients do well. And the quality of life is excellent.
So, Doctor, there will be a permanent cure also available.
If not cure, also, we are making it a chronic disease. You take this tablet, you will be okay for 2, 3 years. Then if the disease progresses, I put you on another tablet. So this way you're extending life by 4 years, 6 years, 7 years, who knows, up to 10 years also, like any other disease, like CML, chronic myeloid leukemia, blood cancer patient. Now they live for 15 years, 20 years just on tablets.
Wow.
I may not say they're cured. Yes, technically there are a few people even cured. I may not use that term in lung cancer, but even if my patient lives long enough taking tabs, reasonable cost, no side effects, quality of life intact, what more do we want?
Even chronic is like nowadays, it will be like a taking a BP tablet or a sugar tablet every
That's
day.
it. That's it.
Very common kind of a thing. Thank you, doctor. Thank you once again for a wonderful information on lung cancer. I hope the message what Dr. Krishnamani has given, please, please, please quit smoking. So
Thank you so much.
thank you for everyone for staying tuned. Stay informed, stay healthy, and from Cancer Rich and quit smoking. Thank you, doctor. Thanks a lot.